Hello, this is my video for ethical and legal considerations within nursing informatics. I'm going to be covering social media and the use of devices in the hospital or care setting and some of the risks that you can have with the patients and how to better protect HIPAA and better protect the patient and the workers and how to avoid any violations and how to avoid any breaches of the patient's data. I know especially with the COVID-19 pandemic, a lot of patients, residents, even at assisted care facilities, they're using technology to be able to contact their family members. They're using FaceTime, they're using devices, whether it be like at the facility. I know one of the facilities I work at, they actually bring in an iPad and the patient is able to talk to the family member. So just overall with all of the technology, we need to be sure that we're protecting our patients. And I'm going to go into a little bit of that. I have a couple of scholarly studies and I'm going to explain what I've learned from these studies and a little bit of evidence-based data that is going to help us as nurses continue to move forward safely in protecting our patients. So as we know, technology is constantly changing, especially with a lot of apps like TikTok and Instagram, YouTube. A lot of healthcare professionals actually make accounts on there and they help give medical advice and they help spread information that is for the best public interest for health. And they do it in a lot of fun ways. I know when I was in nursing school, I used a lot of these websites to help further my education and my understanding, whether it be like a skill or something that we were covering. There were a lot of great nurses that had made some excellent content. However, we have to be careful that we don't show our patients in these videos. We have to be careful that we are always mindful of HIPAA. I looked at this one study and it said that nurses, especially new grads and nurses in facilities, they need to have continuing education, or it is recommended that they have the continuing education so that they can make sure that they're not breaching any patient trust, they're not breaching any of their data, that the patient is always being remained safe. I know it's very easy to maybe say something in a post or in a picture or something and to make a breach, and it could definitely put your job at risk, and it could also put any licenses that you have at risk as well. So another study I was reviewing was the ethics and legality of using personal smartphones to take medical photographs. And this was a study that was done. One of the case scenarios was a 45-year-old female was in for surgery with a plastic surgeon, and he wanted to document the before and after phases of the surgery. So he had asked the patient if he would be able to take a picture of her, and it happened to be in the genitalia area. And however, he was using his own personal device. The patient at first declined and said no, but after further discussion, they agreed with it and said that it would be okay. The physician took before, preoperative pictures and post-op pictures as well. However, then after the surgery was said and done and within the following weeks, there was some issues of privacy, and the patient was concerned where those pictures went, how they were, if they were being saved somewhere, and why the physician was using his personal device. And then with a further look into the hospital policy, it said personal smartphones should never be used to take medical photographs. It risks violating the privacy and confidentiality of the patient. Personal smartphones are not only used at work, but also in the home and public areas. Therefore, it is a risk for the doctor-patient confidentiality, and it may be breached if the patient images are revealed, for an example, like a social interaction wherein personal photographs are being shown to others. So kind of like in relation to my other article, case study that I was going over, that even though the doctor may not mean to share, a picture, he could actually, say he's showing his wife something on his phone, and it accidentally pops up, it's supposed to be a picture of him and his child, but then it pops up, the picture from post-op of surgery. So now he's actually broken HIPAA, and you have a whole other issue with the patient being exposed, and when their information should have never been out there. So it really talked about how we need to avoid using our smartphones in the work environment. especially when we're, to take pictures of residents or take pictures of patients. We need to avoid that. And it further discussed how it can really put the patient's privacy at risk. It can break their trust in medical field as far as nurses, doctors. They might feel like they're at risk all the time of being exposed after they've had an incident like this. The study had also went into saying, for as far as recommendations, and after they did all their research, they said verbal patient consent is insufficient. Therefore, obtaining a written informed consent should be standard practice before starting any treatment that requires a medical photograph. And that way, if anything should go wrong or anything happens, you always should have something in writing, something that can be brought to, as far as to a court record. You can't just have someone's, their say or word of mouth. It needs to be in writing. It says informed consent is the physician's responsibility, even if it is delegated to a member of the staff. The physician should explain and discuss the purpose of the medical photograph, its potential benefits to the patient, and the management of the patient's condition, as well as associated risks and who will have access to the photograph. Such information should be clearly stated in the consent form. So at all times, the patient should know what the picture is going to be taken for, how it's going to be used, and how is it going to be protected so that their information isn't leaked out into eyes that shouldn't be able to see it. So in conclusion with this study is that using smartphones for medical photography is faster and more convenient and widely available. However, ethical issues such as patient confidentiality and privacy may be breached when using smartphones to take patient photographs, especially when using personal devices. So they're saying, therefore, it is recommended that only hospital equipment be used and written informed consent be obtained to avoid litigation and ethical misconduct. So they found out that if the hospital gets their own device, that way it is hospital property. It can actually stay at the hospital at all times, and you don't have to worry, whether it's a physician or a nurse, of breaching privacy and accidentally having a leak of someone's information. So as nurses, we always need to stay aware of policies as they're changing all the time, especially as technology is changing, so that we can better protect our patients. We need to have an understanding of how to use these programs. For example, like in my workplace, a lot of the nurses were trained how to use the iPad and the app that they were using to contact their family members while they were in isolation, whether it be from COVID or something else, so that we can effectively use these devices and the apps on them, and that our patients are safe throughout the whole process.